Hello. We are so excited today to have my chiropractor, Dr. Haley Wrisinger, with us today. And so we're just going to jump right in. And I would love it if you would just tell us a little bit about yourself and your practice and how you became interested in chiropractic care. And yeah, just anything you want to share.
For sure. So my name is Dr. Haley Wrisinger. I own Evergreen Chiropractic. It is a prenatal, pediatric, and family wellness chiropractic office in downtown Lee Summit. It's in a little house that's super cute. So I have one little boy. He is a year old. His name is Brooks. My husband and I have been married since 2016. We're both in the military. I'm getting out of the military in May, so I'm almost there. It'll be 10 years at that point. So that's been keeping me busy over the last decade, but now I'm ready to step full swing into motherhood and just business owning and trying to mellow down my
No,
life.
just those two minor things.
Yeah, just minor things. It's fine. It's great. And then we have two German Shepherds, Bonnie and Clyde. So it's really fun having our family dynamic. But what originally got me into chiropractic care was really that I grew up riding horses, and I was very competitive, and I competed all the way through college. And my horse actually got adjusted when I was younger, and so that's actually what really got me into chiropractic care was I realized like how much better he performed after he got adjusted, and that's what kind of got me interested. And then we had family friends that were going to chiropractic school not too far from us. And I knew that I do not like to sit down. I really like to be moving. And I needed something where I was going to be using my hands and where I didn't have to just sit down at a desk all day. And it really seemed like a great fit because I'd be working with people. And that's just really what I love to be around. I really love to be around families. And it's just always been a huge passion of mine, just being around kids and families. I was a babysitter growing up, and then I started nannying and I worked in a preschool. So I've always really loved being around moms and kids. So it's just really always been something that's on my heart, and it just blended really beautifully with chiropractic.
That's so awesome. That's so interesting that you got there kind of through your stuff with horses. I never would have.
Yeah. Yeah, kind of roundabout way. It's on my bucket list one day to be an animal chiropractor, but that's an additional certification. So I'm just kind of waiting, enjoying life for this
Yeah,
season.
cool. So I started with my first pregnancy. I started seeing a chiropractor like late in the my second trimester, and it made a world of difference in the pelvic pain that I was experiencing. But this time around, I wanted to, as you know, jump in as soon as I could. And I actually contacted your office before I even was pregnant, hoping to like optimize things during that process. But anyway, I got pregnant quickly. And so I've been with you. You were like one of the first people to know that I was pregnant, which is cool. So I just feel so much more grounded and I have less anxiety. And I feel like it's all linked back to the care that I've been getting from you. And I just want you to talk about like when you're treating someone who is pregnant, what are some of the things that you're thinking about and addressing beyond just like the aches and pains of pregnancy?
For sure, for sure. And that's actually really common for me to know that someone's pregnant before a lot of other people know.
Yeah,
Sometimes
I'm
I
sure.
find out before the spouse does, which is kind of weird. So it's really fun and a unique thing that I get to do, and I really love it. But the biggest thing that is really important with chiropractic care, especially during pregnancy, I mean, for all stages of life, but your brain and body are connected neurologically. And so we want to make sure that that is a clear pathway. It's 100% communicating from the top down and bottom up. So when our brain is talking to our body at 100%, then we can function really great. Our body moves with ease. We feel like we're moving with ease. We're really healthy and we feel good. And so whenever our body has interference between the brain body connection, chiropractors, we call that subluxation, we are going to have malfunction in our body. We're going to feel dis-ease within our body, and we're going to have ill health, and then we're not going to feel great. And that's the effect. So that's where we see the symptoms show up, and that can show up and manifest in a lot of different ways. Chiropractors are the doctors of cause. And so we help to address that subluxation to restore that brain body connection so you can get back to functioning well, get back to feeling well, and get back to doing what you love so you can stay healthy. And the biggest thing that I see during pregnancy is that there is a disconnection between the brain and body because mom and baby are connected nutritionally, but also neurologically. So if mom is really stressed out and wound up, baby stressed out and wound up. And so that is going to manifest in a lot of different ways, even post birth. But it's really important to just help to balance your body, balance your nervous system. And we also do a technique that's specific for pregnancy called Webster technique. So you do have a certification for this. So if you are looking for a chiropractor who is certified, there is a link on the ICPA website that you can find a certified chiropractor near you who is Webster technique certified. And so this is specific to pregnancy to balance the bones, muscles, and ligaments in the pelvis to help keep you more comfortable, help making sure neurology is balanced. Because when mom's body is balanced, then baby can have the room that they need to move around. So it's really, really great during pregnancy because it keeps you more comfortable, just makes you feel a lot better in your nervous system. And so that's why it's so great to have that balance in your nervous system so we can get your body out of that fight or flight response that sometimes we get into and into that rest and digest where we can feel a lot calmer, feel more comfortable in our body. So that way you can do the things that you love when you're pregnant and continue to do them into postpartum as well.
Yeah, that's so awesome. Um, so what kind of issues do you find yourself addressing with your pregnant patients like over and over? I know with my sleep consulting work, I'm always answering the same questions and I feel like I'm always troubleshooting the same things with clients. Do you find that in your work with pregnant patients?
Yes, big time. So definitely just overall comfortability, being able to move appropriately. A lot of women get like pubic symphysis discomfort or round ligament discomfort or SI joint discomfort. Nausea, that's another one that I hear about really, really often, especially during that first trimester. Hopefully it doesn't last beyond that for most moms. Um, what else? Low back. Big thing is just also being able to like get up and down to be with their other kiddos on the ground. That's really important, and that comes with the comfortability and that mobility in their pelvis. Also, there's a lot of emotional roller coaster things happening and shifting because hormones are changing drastically at this point. So that's another thing that I really hear from a lot of moms, and energy levels. That is definitely a big one as well.
Yeah, I've noticed that I feel just like so much more even keeled this time around. My energy levels also are like I feel so good, which is crazy because I also have a toddler at home this time and I'm working overnights, which I was not doing the first time around. So
Yeah.
I definitely feel like that has been such a positive effect for me. So
Yeah, working overnights would be a whole nother ball game when you're pregnant and then
yeah.
add a wild toddler on top of it that you're keeping up with.
Yeah, it's starting to catch up with me, but we're still hanging in there for now.
For sure, for sure.
Okay, so let's switch gears and talk about postpartum a little bit and how you can help families during
Mhm.
that really sensitive time where there's just so much change going on. Can you tell us some more about like the things that you're helping moms and babies with at that point postpartum?
Yeah, absolutely. So there are a lot of huge physical shifts, chemical shifts in your body, emotional shifts after you have a baby. I mean, your hormones drop, they go all crazy. You're learning to breastfeed if that is what you guys are choosing. You're learning to feed a baby. And so you're holding a baby, you're really forward in your body, you're feeding them, and it's very anterior. And so a lot of moms we'll see jaw discomfort or that like upper thoracic area starting to really creep in and give them problems because they're so forward holding a baby. And just emotions are really sensitive because you're trying to learn all these new things. Even if you've been a seasoned mom, it's still a very sensitive time. I mean, you're relearning and reorganizing your body into all these new things and trying to remember, oh, yeah, okay, this is what it's like, or this is all new for you. And so it's just really hard on your body And it's a huge shift. And so just having that nervous system balance so we can make sure that your brain can communicate those hormones properly, your emotions properly, so that way you can have the most balanced nervous system. Because if you potentially did have a really traumatic birth experience, that's going to send your body into a fight or flight response, and then you're going to have a hard time connecting with your baby. And so making sure your nervous system is really balanced and can communicate well, so that way you can feel calmer in your body, that's going to help your relationship with your baby, because they feel everything we feel, in utero and postpartum as well. And so just having that connection, between brain and body is so important, so you can continue to feel healthy, continue to feel good, because it is a lot physically, chemically, emotionally, huge shifts postpartum, and having that support team. I'm just one of the many people that you should definitely look into and have on your team, postpartum, but it is a night and day difference. Our moms are like so grateful postpartum, because when I talk to them, they come in for prenatal care, and I talk to them about like, okay, I understand we're prepping your body for birth, but we need to look also after birth too, because that's a very sensitive time, and our society loves to focus on prenatal and then forget the mom's postpartum, and it drives me nuts.
Breaks my heart too, because that's when you need that support the most, I feel like.
Absolutely. Such a sensitive time.
Yeah. Can you talk some more about how you can help moms who choose to breastfeed? And like, I know you've talked to me before about like if there are tongue tie issues or things like that, you can help to address some of those struggles.
For sure. So breastfeeding is the most natural and natural thing that you'll do in the beginning when you're first learning it, even when you're learning a new babe. Just because it takes the commitment in the beginning. And sometimes if the baby was really cramped up in utero and they had an off positioning, that's going to create tension in their body and then can transfer that over into the breastfeeding journey and make it harder for them to latch. So oral ties, when they do show up, it is not just the oral tie, it is a whole body tension. So yes, the tongue and lip can be tethered and taught, but it is a whole body connection. So your tongue's connected to diaphragm, pelvic floor, all the way to your toes. So a lot of babies with oral ties will have latch difficulties, but then they'll also be super tense in their bodies and have preferences from one side to the other. They can have reflex difficulties, colic-like symptoms, and just really struggle functioning as a whole. And so if families do choose to get an oral tie release, it's so night and day difference if they get body work and decrease that nervous system for the baby out of fight or flight to prepare for that release, because that is a trauma.
Mhm.
Getting a release done, that's a
Yeah.
physical trauma to their body. And so helping to calm their nervous system, so we're not doing a surgery to an already overstimulated baby, so that way they can heal better on the other side of that. I've seen babies come in pre-release, and then I've seen babies who strictly come in post-release. Their healing is drastically different. The babies that come in pre-release, it is amazing to see their results. In post-release, if I don't see them and they don't get body work beforehand, it's really a hit or miss situation if they're going to have a successful journey continuing on with that, because they didn't address that initial tension in their body. And just having that nervous system really prepped and calmed is a huge difference for oral ties specifically.
Ooh, I feel like that's so important for parents to know. And I think, I mean, people just say, "Oh, just get it released and it's going to be fine." And then there are just so many more issues that come up. And yeah, I feel like people just maybe don't know or don't see the full picture of the benefits that can come with body work, specifically with tongue ties. And
Yeah, and I do a lot of work too with like palate shape and just helping to make sure that their palate is properly balanced, because it is two separate bones in the beginning. And so the palate should be a nice rainbow shape front to back and side to side. So that's also a part of the equation too of why they might be having a difficult time latching or getting a lot of air in, because they could have really high palate. And so allowing the cranial bones to shift and unwind and relaxed from maybe being in the birth canal for too long, that can create a high palate and helping to mold and reshape their cranial bones and allowing that proper movement that each of those bones does. It really helps to balance out that palate and give them a better foundation for just that oral function. Also, the cranial nerves, 5 out of the 12 of those are specifically for oral function and control. And so when we adjust up there, that's helping to make sure neurologically they are communicating from their brain to that oral function. And if babies do get a C-section or are assisted out, they're literally like grabbing their skull and pulling out with up to 120 pounds of force. And that's where their life, their brainstem, that is what controls and is able to communicate how healthy we are, how well we function. And so imagine going through that trauma and then trying to breastfeed, and you're like, my body feels so overwhelmed because I was just pulled out. And while yes, this is a necessary birth sometimes, it's also really hard on their bodies. And that way we can see those second and third order effects of just difficulty in their overall function in breastfeeding. So it has a multitude of benefits from a lot of different angles.
Wow, that what you just said about C-sections just makes me think back to my own C-section and my daughter's birth, and I'm now like even more amazed at how smooth our breastfeeding journey was because
Yeah.
yeah, I had no idea. That's crazy.
Absolutely. Absolutely.
So a while ago you mentioned babies with colic and like reflux and things like that. Can you talk about what you can do to help those kiddos?
For sure. A lot of those babies that I have seen are a lot of times mom was really stressed during pregnancy, and that is how these started to manifest because the nervous system starts developing at conception. And so everything mom feels, baby feels. So what we feel is going to shape our baby's nervous system. So if mom's really stressed during pregnancy, that's what baby is going to think when they come earthside. And so when they're stressed, they can't function as well. So then they're fussy, they don't digest as well, they might have reflux, they might not have regular bowel movements, they might be more gassy, have more tension. And so it truly is helping to focus on balancing the nervous system, getting them out of that fight or flight response. And we see a night and day difference. And there are situations where it is potentially could be a true food intolerance that's causing this. But out of all the babies that I've seen, that's only been twice, and that they've had a true food intolerance. And so it's super important to not just like jump to, oh, it's a dairy allergy, because it's not always a dairy allergy. I've only seen it one time, and they would literally projectile vomit if they had any dairy at all. And even if you didn't know, go ahead.
I was just gonna say that looks totally different from what even as I see like as a postpartum doula, where moms are like, oh, they have really bad reflux or they're really colicky or things like that. That's not what you were just describing with the true dairy intolerance.
For sure, for sure. And it's interesting because even like salami's cured with dairy. So something as small as that, you have to be so cautious of if it is a true dairy intolerance. But a lot of times those babies are a different baby. We call it like the light switch effect. Like all of a sudden they will just switch and be a totally different human, and they'll be calm in their body. They won't be fussy. The mom will be able to go out in public again, have family dinners, and really connect with her baby like she was intended and designed to do.
Wow, that's so powerful. Like we all know, or if you're a mom, you know how stressful it can be to be around a fussy baby. And when it's constant, to just be able to work your magic. I know it's not magic, but I'm sure
Yeah.
it's like that to parents who have a baby who's chronically
Yeah.
fussy. And yeah, that's amazing.
Yeah, and it's super hard in the beginning with those like colicky babes. They are like screaming for their first like few appointments. And I tell the parents that I'm like, it will get better, it will calm down, but it is hard in the beginning because we're trying to change the neurology and their body doesn't want to change. It wants to stay where it feels comfortable. And so their bodies are trying to fight in a way what we're doing, but the amount of pressure that I use is literally the amount of pressure that you would use to check the ripeness of an avocado. So it's super gentle, super effective. And one day that neurology will just flip and the baby will be calm and relaxed. They won't have closed fists anymore. They'll be actually calm in their body. They won't be tense when they feed. And so it's super, super cool to see those shifts.
I'm glad you said that about the amount of pressure that you're using, because I hear parents talking about like, oh, I would never see a chiropractor for my baby because that's crazy. And I mean, I think it's just a misconception that you're using like the same amount of force that you would use on an adult, and or not force, but pressure. And
Yeah.
I'm glad you said that.
Yeah, definitely.
um, let's see, is there anything else postpartum that you want to talk about over here?
Yeah, I mean, there's definitely just moms in general. We just have a higher load placed on our bodies. Our kids love us and literally thrive off of us and our function. And so I see a ton of moms for mom stress of just trying to navigate all the different schedules, all the different lifestyles, all the different kids and emotions and personalities. And it's a lot. And our nervous systems are often the ones that take a big hit because we're trying so hard to just balance out everyone else in the house that we forget about ourselves. And so I see that constantly. And the coolest thing with a lot of our moms is once they do start to feel that balance and calmness in their nervous system, they are like, okay, I have more energy. That's usually the first step. Or they notice they don't get as overstimulated when they're trying to leave to get out of the house. And they can actually calmly navigate that situation. Whereas before, they would maybe get angry or be short with their kids. And it is hard because I mean, think about it. Kids are really loud. They're very overstimulating just to be around. This morning, I was at a cafe playing with my son, and it was really quiet when we were there. And then right before we were about to leave, there was a lot of like older kids that came in, and I started to feel overwhelmed because it was just loud, overstimulating the noises. And that's how it is when you have a lot of kids and when there's a lot of chaos, and your body can feel like you're in a fight or flight response because of that. So definitely helping moms to just navigate that journey and just to help them be the best version of themselves. Because again, even into as our kids grow older, they feel everything that we feel still. Their emotions are balanced off of our emotions. So I see that so commonly where it's cool too. I've seen moms in different seasons, and I can see when they talk about the different seasons of their life and how different each of their kid is, and how the oldest kid, they were really overstimulated in that season of life, and the youngest kid, they have felt more like themselves, and that kid is more well-rounded, just calmer, less overstimulated, less sick. And it is really cool to see the difference, just from my perspective, kind
Right.
of nerdy things, but also to be able to just notice that, okay, this is truly affecting our kids even into like 8, 9, 10 years old plus on through their life, of just how well we are balanced neurologically, because it affects their neurology as well, into adulthood.
Yeah. I feel I feel like it's a similar thing with sleep. Like the parents that I see when we start working together, they're just super stressed and they don't have that capacity to calmly deal with their crying baby or to know how to handle different situations. And then by the time we finish up together, they just seem so much more relaxed because they're getting sleep and their baby's getting sleep and everyone's more balanced. And I definitely, they're not the same, but they're similar. And yeah, it just, we do have a lot of pressure on us as moms. And
Yeah,
I'm always happy when I hear that people are getting the support that they need to kind of
yeah,
navigate, especially early motherhood, all the different challenges.
for sure. Absolutely. Absolutely. There are a lot of overlapping similarities to what you do and what I do. And I mean, they, like you said in the beginning, like they're overstimulated. They're trying to calm a baby when they're upset as well. And you just feel like, it's so hard. We put so much pressure on ourselves as parents. You feel like a failure because you can't do, like, you can't put your baby down to go to sleep. And
Right.
you're like, why is this so hard? And it affects both. And then it just escalates. And then you're both crying and
Exactly. Yeah. Yeah,
it
it's a
doesn't go
slippery
well.
slope.
Yeah, totally.
Well, thank you so much. I would love for you to share just how people can get in touch with you if they're local and want care, or anything else you want to share.
Yeah, so you can find us. We are in downtown Lee Summit, just off 3rd and Independence Avenue. You can always call us to schedule or book online. So you can find us at evergreenchirokc.com or on Instagram. We post a lot of information on there. It's at evergreenchirokc. I post a lot of posts there, which is information on why chiropractic care is so great for all stages and all ages of life. I'd love for you to reach out and come check out our office. It's super family friendly and it's very adorable. We have chalk outside right now because
Oh,
February is
that's fun.
weird and it's so nice. So we have sidewalk chalk out that the kids can play with while they wait. And it's a really, really cool environment.
It really is. My daughter loves going with me to my appointments, and she's always sad when I tell her that I went without her.
That's awesome.
Well, thank you so much. This was awesome, and I'll see you Monday.
Sounds good. Have a great day.
Thank you.